Welcome to the 23rd episode of Tokenizing Everything, a weekly interview podcast series with thought leaders in the blockchain industry. Today we have a special episode with the core team of My Health and Catalyst Technology, whom I'll be speaking to about applying blockchain in the healthcare sector. Before we begin, I have to mention that all opinions are solely personal and do not reflect the opinion of Amazing Blocks or any other involved parties. So welcome guys, it's a pleasure to have you here today. Would you all maybe just briefly introduce yourselves? Maybe we'll start with Lili.
Sure, thanks Nicolas. So my name is Lili Tcheang. I have a background in neuroscience. I worked as a neuroscientist for about a decade before moving into industry, working as a data scientist, helping companies understand their products, understand their users better, and hence develop better products. And from there, I moved on to consulting, working for a research technology organization, helping UK businesses understand and implement AI and machine learning solutions in their business practices. As part of that role, we also helped a number of startups who had an idea for an AI or machine learning product. We would help them get the resources in order to develop or train those models further and help them understand the landscape in order to place those products in the marketplace.
Okay, thanks Lili. Maybe Marcus, you want to go next?
Yes, of course. Sorry. My name is Marcos. I am a developer all my life, 50 years experience. I background in physics, but I am in the crypto space since 2017, 16, and working for Bitcoin, developer of Bitcoin Cash. We started this clever thing, which is a brand new blockchain. And over this, we created My Health. So I am responsible of the development of the whole technology stack behind My Health. And a few months ago, I joined also a new economic movement, as a co-developer. This is my background, basically.
Thank you, very interesting. And now, last but not least, you, Edward.
Thank you very much. My name is Edward Cole, as you can see. My background is from an economics education. I worked in the City of London, trading government bonds, specializing in inflation bonds. And key really to success in risk management and trading government bonds is really the quality of the data analytics. And in the City of London, as many people know, there's been many changes over the last 30 years, not least improved by the access of the data using systems. Spreadsheets have come in, Microsoft tools have come in, and of course, Bloomberg as a platform has been very successful in helping us in that process. But it all depends on the quality of the data. In the city, we're always conscious of fraud. You're always conscious of bad actors. And I've recognized the value of blockchain and the new types of ways of agreeing on what the truth is and making sure the truth can't be disturbed. So I've had a really fabulous time since I've left the trading process, getting involved more in the regulatory reporting and that type of thing, of being introduced to people like Marcos, who've been having a lot of fun, I think, getting involved in the Bitcoin crypto revolution, which is partly stimulated by, of course, the failure of governments to manage currencies very effectively in the 2008, 2010 problems. So that's probably enough for me for the time being. Thank you very much.
That sounds very interesting. We have a very diverse group today. So maybe to you, Lili, as kind of, the healthcare expert in this group, why did you join this space initially, and what excites you most about it?
Certainly. So through working with a number of AI machine learning companies, the problems that these companies typically come across is a cold start problem with data, essentially. So they don't don't typically own these data sets or have access to these data sets. So in order to develop and train their models, they need to gain access by brokering these relationships with the data holders, and these can be various organizations. So they typically spend the first couple of years essentially getting hold of that data in order to train their models. Now, you can imagine that with something like the Catalyst blockchain platform, a future whereby if you as an algorithm developer want to develop a model for, say, for instance, cardiovascular disease for a group of males or females in a certain age range with certain conditions, you can essentially broadcast this out onto the blockchain network and instantly get access to this data. Unfortunately, that system doesn't exist today because people are very wary about releasing data. There are certain regulations in healthcare that also increase the barrier to entry for these individuals. And on top of that, people want to keep control of their data. So at the moment, trying to get hold of each of those individual data sets from your hospital, from your GP, perhaps even from a wearable device that you have, and get those integrated into an easily digestible manner for something like a machine learning model is actually a huge barrier for a lot of these companies at the beginning. Whereas you can imagine that this problem essentially just disappears if this information is held on a blockchain network, whereby you hold a wallet, your GP holds a wallet, the hospital organization holds a wallet, which allows you to pre-permission which data from your GP, from the hospital, you would like to share with a third-party organization, depending on their credentials on the network as well. And the beauty of this system means that it's a dynamic system, so that in future, if you decide that you no longer want to share that data with these organizations, you can do so. And that means that historical data on the network, despite the fact that it's been collected maybe 10 or 20 years ago, the permissions should always be up to date as to whether you want to share that data or not. So these organizations don't necessarily have to go back and trace each of these individuals in order to ask for consent again for data that's now quite old. That information should be pre-permissioned on their wallet, which essentially just smooths this process of data sharing throughout all of the players on the network.
Okay, yeah, this sounds very interesting, and I think since data is increasingly becoming probably one of the most valuable goods, so to say, of our time, I think you're really in the right industry also in terms of merging it, since it's obviously also a crucial factor of the healthcare industry. So maybe to you, Marcus, as the blockchain expert here, the blockchain enthusiast, I'm sure Edward and Lili are too, but you've been in the industry for quite some time. People always describe a certain wow moment that interested them in this topic. And what was your wow moment? And, why did you actually go all in on the blockchain space back in 2016?
Back in 2014, I think my wow moment was when I read the Satoshi Nakamoto paper, which just it started all right thinking. I started professionally working on the blockchain space in 2016 at the fall, so at the beginning 2017, and it was wow. I mean, because Bitcoin was the first cryptocurrency, but soon after arose Ethereum with its proposal of tokenization, and smart contracts. So you could see that the thing was getting more powerful. Then everything spin around the concept, various concepts, but one key concept is the absence of a third party. So it is peer-to-peer, basically, the concept. So no central planning, because this movement arose in the cypherpunk environment, and it's all about, with the introduction of computers since late 80s, it was a risk or a worry of massive surveillance or excessive control. So these guys started with cryptography, envisaging systems for protecting the privacy of the people. And several attempts, Handcash was the first attempt, but was centralized, but then came Bitcoin with decentralization. So we have to meet several things here. Fundamentally, we have to meet security, scalability, decentralization. This last one is key for resilience and avoid censor. A system that can be censored by a central authority. These are the three key elements of the blockchain. Bitcoin only focused on two of them. It missed scalability, and Ethereum as well. So today we all are working on scalability because we have solved the other two vertex of this triangle. It's called the trilemma, the scalability trilemma. Some solutions are better than others. Well, this starts or ignites the new developments based on Bitcoin, altcoins, but many of them were genuine. So many of them were kind of copy of Bitcoin, changing some parameters, and you get Litecoin or Dogecoin, but others are genuine. Algorand, NEM, in our case, Plevel. NEM was started in 2013, so it's pretty old as well. But that time it didn't incorporate tokenization. But Plevel introduced a very lightweight system of tokenization, and NEM at the beginning of this year, in March, so 2 months ago, we started a new mainnet with tokenization system, and they share the same, mostly the features. The intention is to tokenize the value, and so to allow change of value that are regulated with a coin or a number, let's say that way, that you can, in every exchange, when there is a value flow from A to B, simultaneously there is a coin flow from B to A. So it allows a massive accountability of every value exchange, but not in a centralized way like currencies do, because every value can be tokenized. For example, if I buy bananas, I use banana coin, and it's a stable coin that is connected with 1 kilogram of bananas. And this is something that we have not seen. Yeah, it's an unseen, because it requires AI in the wallet. So it requires very powerful wallets that can manage thousands of hundreds of thousands of coins, every one representing different types. In the case that we are dealing in health, we have to combine the value for a patient is, let's say, the health. So he wants to be healthy. It could be tokenized. Because when he gets help, it's all about delivering this value to the patient in all the different forms. In my little understanding of the health system, I just synthesize what is the big picture of what is going on from the point of view of the technology. To manage that, we have created a very powerful wallet that not only includes the handling of the tokens related to the health industry. But also we have created this concept of roles that enables a system that is role-centric, or in the proof of concept we did last year with our patient journey, is patient-centric, for which a patient with his wallet would run protocols with other actors in the system, the GP, the doctor, the specialist, an AI provider, and a pharmacy, and do interactions, exchange different types of values, and finally get delivered the medicines to home in one go. So with the mobile, he would just visit all this sequence of actors and keeping the health records in his wallet and sharing the bits that are required on every step. For example, in the pharmacy, he would exchange the document that previously has been received by the specialist, which is a prescription, together with pharmacoins, let's say, for which they can, the pharmacy would require to present the prescription, otherwise the medicines would not be added to the basket. So everything is mostly controlled by the wallet, and the experience for the patient is nearly straightforward.
Okay, yeah, that sounds you know, like a very disruptive tool, you know, for the entire health industry, which I think, especially now in the age of COVID-19 and the current struggles and the, you know, lack of clarity here and there, could definitely help, especially also with the upcoming or the ongoing vaccinations and topics like this. So, you know, props to all of you guys for you know, developing such an, you know, I would say, yeah, no pun intended, amazing tool, right, for the health sector. So maybe to you, Edward, can you share us maybe some insights on the current status quo of blockchain in the healthcare sector in general? And then maybe as a follow-up, how do May Health and Catalyst Technology work together? What is the status here?
Okay, there's not a lot of information about how much blockchain is being used or accepted in the healthcare industry. And my knowledge is limited, and we've done some research. Most of it is academic, most of it is promise, if you like, but there's not any real evidence that blockchain is accepted by the decision makers within the healthcare system. So it is very disruptive. It hasn't really been used in any meaningful POCs or practical ways that people can see the benefits. And I think this is very much a barrier to its adoption. So it remains still a talking point for people who understand the technology, rather than enough of a talking point about people who understand how it can deliver exchange of confidential data in a private way, so that more research can be done on that data with the consent of the patient. And that being able to bring, and this is what Lili's very good at explaining, being in the AI, in the artificial intelligence and data analytics space, is that people struggle to get access to this data. And actually patients want to share the data, but because the data is held on so many different systems under so many different people's control, it's not possible for that data to be shared. So we have an inefficient system. I think there's a willingness and there's an acceptance that we need to put the patient in control. But it's a big challenge to get the decision makers to take that little risk and test this new technology. And sorry, you asked a second question and I've forgotten what that was. I think it was something to do with how does My Health sit on top, or it sit within the Catalyst business?
Exactly, yeah.
Yeah, very good. Well, the basis of our business is being so very well explained by Marcos who's told us all about his experience in Bitcoin, his experience in, well, he didn't mention his experience in aeronautics, but I like to do that because I think it's quite fascinating that people had aircraft to aircraft communications to agree on missiles targets before they decided on other things. So we have a great provenance. He's built this platform, but in order to make this platform useful for industry, so I met Marcus a year before we set up Catalyst, and the purpose was to cross the chasm, to use the jargon. It was to stop talking about the technology and get across the other side of the chasm by building applications which were relevant to industry. And My Health was our first application. We did this in responding to a white paper published in Barcelona by a private health company, a private clinic, and a diagnostics company. And what they wanted to do was build a system for predicting cardiovascular disease using machine learning. But what they couldn't do was manage the data efficiently, and that's where Catalyst technology could help. So together, we built this proof of concept and minimal viable product, which is My Health. And as a company, we built a very, I guess, unique, Marcos, if you want to jump in, but a unique architecture that allows front-end applications to be built on the core distributed operating system.
It's unique because I haven't seen anything incorporated in a wallet. Other approaches rely on adding encrypted data into the blockchain, while ours is not. Is the wallet. So is that you keep your secret with you, which enables other features. For example, monetization of your data. Perhaps you want to give your X-ray pictures to a cancer research facility for free, but you don't want to give it to a private company for free. So you can trade, and you can let your wallet trade for you while you are sleeping, because you just have to parameterize how do you want to export this data that so far is completely private to the world. So the platform gives you the flexibility to program in advance not only medical data, but any your pictures. Instead of giving them to Facebook, you can monetize them straight. Facebook makes her money by just capitalizing on your private data. So the intentions is to dissolve these giant companies that are getting everybody now the profits of giant profits. When at the end of the day, the profit belongs to the producer. Right.
Yeah, that's definitely a crucial topic here. So maybe at this stage to you, Lili, the question, what has been, the feedback thus far within the industry to your solution, and where do you really see currently the low-hanging fruit of applying what you've built?
So there's, Marcus, do you want to go ahead?
No, we'll do it.
It's a process. I think it's a process. And on every process, first they laugh at you, second they fight you, and third they end up accepting and getting into the game. We are seeing that with banks. So banks are generating their own cryptocurrency because they cannot fight the original design, but they are doing the twists just to remain in control. But the whole point of this is to remove control from third parties. So it's a fight because there are completely different solutions, points of view, and it implies a wealth transfer. So people that so few people that accumulate the bigger power or wealth are going to fight against a system that would create a more fair redistribution of the wealth. At the end of the day, this technology would make a better world in many perspectives or top areas, if not all of them. So it's a fight. But obviously we have a lot of questions because a new technology is not understood completely. So it's a lot of work of explaining or trying to get people that are used to understand centralized systems. But this is a brand new paradigm, so it comes at a cost. But let the time go.
Yeah, I think definitely. And I think, Lili, you had something to add?
Yeah, just to add to what Marcos said, there's a lot of enthusiasm from the healthcare sector for this technology. The problem that they face at the moment are the immediate crises that we have with coronavirus and so on. So there isn't as many resources as we would like that can be diverted to something like this, which is a foundational technology. It requires a complete change in the framework of how data is shared and transferred at the moment. And it also requires a cultural mind shift away from centralized systems where data is aggregated in one place to one where there's a distributed system where control of the data sits with the data holder. So those are two issues that we're currently facing at the moment. I think anything that we can do within the healthcare sector that alleviates the current problems that they are facing at the moment helps greatly. So in terms of things like remote monitoring, in terms of providing services for virtual wards, and trying to help get people back into what we would consider was normal life a year ago, into large venues and things like that. So those are the avenues that we're trying to pursue at the moment.
Okay, yeah, that makes a lot of sense, that you definitely, look at what are the most pressing issues, right? And then addressing those with your solution. That's also a great way, obviously, I think, to scale. So maybe at this stage to you, Edward, we weekly have a special question from the Be in Crypto community. And this week's question was, which impact do you think that your solution will have on health insurances, actually?
Well, that's an interesting question, because it also is a question which can upset people quite readily, because one of the things about monitoring individual health, if you like, or even sharing your individual health with insurance companies, is people feel that they're going to lose out, that they're going to be penalized and get less access to the insurance they need. So obviously, I don't think any of us are in that particular keen to achieve that particular role, but I think we should concentrate on the benefits. The benefits are that we're able to, the insurance companies are better able to learn behaviors and hopefully encourage better behaviors. I think what, and I'm going to find my feet on this question now, is this is really the key of tokenization. The key of tokenization is twofold. One, you can capture granular data or data at a much more granular level, which means very small. And also you can exchange it for very, very small fractional currency, which effectively puts a value at the very, very low level, the very micro level. Now, that starts being very, very useful. And so you're able to exchange more data and learn more about yourself and only share various parts of this. And the insurance market, and what this does, this tokenization, is it allows people to incentivize and potentially penalize behavior. And what the real benefit is for individuals to proactively manage their health by being able to consult doctors more readily, to be able to wear devices and manage their fitness and their health and get access to advice, and to be able to share the reward and change their diets and be able to share the benefits of that for research. And I think that's where there will be a new relationship with both the corporations you work with, the insurance companies that provide the insurance for their staff. And I think that communication of data will ultimately improve behavior and reduce the cost of insurance.
Just to add to that, Ed, I think one of the nice things about the blockchain platform is the transparency of the transactions. So you can see a future where insurance companies are held to account if there is perceived bias in the way that they are charging for particular premiums, and that can be regulated through this platform essentially. So that there shouldn't be an unnecessary reason why you're charged a higher premium than your neighbour, despite the fact that both of you look pretty much the same.
It's a question that Marcus is very fond of answering. The way that he's built fairness into his technology. I'm not there suggesting that you ask him that question now, but if you want to ask him, you'd be very welcome. Answer.
I think I addressed this kind of questions with a general pattern, which is the question is how about insurance companies. I tend to think a future in which everyone can be an insurance company. So I as an individual, could allocate or control my AI, my algorithms can control the data in such a way that I can negotiate with other person. I can contribute with one pound. So if he send me £1 to me and a few data from his health record, I can do my risk assessment and agree with them that if something triggers the contract, I would pay £10, right? I can take the risk for £10, right? So I am paying 10 times more than the £1 he gave to me once upon a time. So I become a health insurance. So the aggregation of this would get every person covered. It's kind of a concept like a crowdfunding. But this is what the distribution of a new economic movement leads us, right? So we are actively thinking on a society in which that works that way. But this is a futuristic view. In the transition, obviously, companies are doing this with big numbers. But the question is, a few companies using big numbers of millions of individuals doing small numbers.
Okay. So you had something to add? Okay, perfect. So then, as we kind of come to the close of the conversation, usually I have that question, where do you see blockchain in 10 years? Here at this stage, since I have three, guests, I would kind of like to split it. Maybe to you, Marcus, firstly, where do you see blockchain in 10 years from now? And then I'll continue with Lili and Edward.
I see hundreds, thousands of millions of blockchain platforms, tokenization platforms. So the technology itself will be distributed. So we are only watching a few of them. Some of them are maximalist. They want to be the platform that supports the whole society over it. But because I am a maximalist of distribution, so in that framework, I see a lot of platforms. So you will have choices, and there will be interoperability. So it will be a soap.
Okay, very interesting. And then maybe to you, Lili, where do you see AI in the healthcare sector in 10 years from now? I know it's impossible to give a perfect prediction, but maybe just kind of your insights on that.
I think AI is already there in a lot of places in the healthcare sector, but it's just not evenly distributed yet. So we will see it become more ubiquitously used across different settings. And I think that the blockchain technology is a great platform to support the way that data is managed in order to train these models, in order to get to more accurate models and move away from this idea of treating the average person towards more personalized care towards an individual. And I think we have been sort of dreaming about this for years now in the life sciences. And it feels like we should have been there some time ago. It's just that the data hasn't been there yet. And we kind of missed the problem essentially when we were looking at this solution. And I can see how blockchain is going to help us manage those data sets towards developing more efficient AI solutions for healthcare.
Okay, very interesting. And now, lastly, Edward, we've heard a lot of predictions. So maybe out of the top of my head, apart from, obviously applying blockchain in healthcare, which other, or maybe what is your interest with, what is your favorite tokenization use case apart from maybe tokenizing data in the health sector? I see you have a nice picture of Elvis in the back. So maybe in the music industry, the IP sector, what is it for you apart from?
Well, I think you've answered my question for me. If that's, I think yes, tokenizing music. I think somebody came. I do quite like this idea of exchange of value in terms of the human individual. Obviously, in Elvis's case, he was a musician and an entertainer. He had a talent, as George Michael had a talent. And instead of an agent owning the whole of Elvis, and of course, Colonel Parker springs to mind, who kind of controlled him all the way through his life. But in the future, we see a way where maybe I invest in Elvis when he's 17 or 18, just a little part of his catalog. And we can all do that in a tokenized way and all participate and all be fans of Elvis or all have a little bit of Eddie Sheeran. Now, that's not necessarily my favorite user case, but I think it's more interesting than one about insurance-linked securities I was going to share with you.
Thanks a lot for this, and I think that's a great closing statement. So thanks to you guys for doing this interview with me. It was a pleasure to have you and get your insights on the current state of the art of blockchain in the healthcare industry and your auspicious project. So I advise anybody listening to really contact either of you guys and find out more about this project. And to our listeners, as always, if you have other questions about tokenization, feel free to reach out to me anytime. And yeah, I look forward to the next episodes. See you guys soon. Bye.
Thank you very much, Nicolas.
Thank you, Nicholas.
Thank you.
Bye-bye.
Bye-bye.